Circles of Care is a new initiative to train a network of volunteer support teams that will provide health information, practical caregiving, and spiritual support to African Americans living with cancer in Durham, Orange, and Wake counties. A Circle of Care support team is an intentional group of 6 to 12 volunteers organized to provide practical, emotional, and spiritual support for individuals and families facing advanced cancer. Using a team approach, community volunteers pool their talents, creativity, and time to offer more support than individuals can provide. Support teams bridge the gap between people who need the care and those who want to care.
I think that Circles of Care is a nice way of having people volunteer their efforts in an organized way to provide these very important needs without taxing the healthcare system. And it really helps to give people a sense of community. And I think that's important for African Americans. We really feel like our life is lived in a village, and when we become close to other people, we call them our brothers and sisters, or aunties and uncles. And at a time in your life when the walls are closing in and you're being disconnected, it really helps to keep that community, that sense of community, keep that openness so you still feel like you're part of the village.
I think a team concept is a great idea because as humans, we all have different skill sets. There are some people who are very organized. There's some people who are better child care providers. There's some people who are just great cooks. There's some people who drive well. There are also people who provide good quality spiritual support.
And thou hast destroyed cities. The memorial is perished with them, but the Lord shall endure forever. He has prepared his...
I'm not in a situation like I was, They lift me up from being down, And so it just a whole lot. It just means a whole lot to me because I could tell the difference in myself.
It's interesting that people that have been coming in, say, every 2 or 3 weeks for chemotherapy at the end of their chemo course feel lost because they feel that, well, I'm done with treatment, but, does that mean I'm not going to see the physician for 3 or 4 months? And what does that mean for me? In that period of time, is my cancer going to come back? Having support during that period of time is very important. So not just during the actual chemotherapy or cancer treatment, but afterward, having a network that has been with you and knows the kinds of experiences that you've gone through, that can understand your emotions at the end of the day. It's important to have that support.
I had a patient whose parent was becoming slowly and progressively more demented, okay? Which is the natural history of that condition. It's a slow, progressive condition. They were losing the ability to function independently very slowly. This was being accommodated by the patient's daughter becoming more and more and more involved in filling in and making sure things happen, till it got to the point where it was overwhelming. The daughter was totally unaware that there were services that could be available to kind of fit in to assist her as this transition occurred, and also that it would be appropriate to begin to anticipate what the next step, what the next levels of care would need to be. And so she was becoming progressively more frustrated and progressively more terrified of where it was going, because she could see where it was going. She could see the toll it was taking on her as being the primary person responsible for coordinating the care. She could see the risk that it was having on her mother becoming more unable to, basically negotiate just the normal activities of daily living, and she had no recourse. She saw no light at the end of that tunnel.
I really feel like when Dr. Hansen asked me to be a part of the project, it seemed like a very natural thing to want to get involved in, because contrary to popular belief, doctors do worry, what's going to happen to this patient when I send them home? And it was a nice way to help me fill in those blanks in my mind.
I tend to think I have a fairly unique focus because I've worked both in Africa and in the United States, and it's pretty common across the board that people who live in underserved communities, who don't have insurance or who do not have resources financially or support wise, tend to have less access to medical care, less focus on themselves in terms of things that are important. People often neglect health concerns when they're dealing with family issues or and such. And so I do see that a lot of my minority patients, or those who do not have health care, tend to come in at later stages of disease, which is very unfortunate because we have a lot of patients coming in with illnesses that otherwise may have been better treated or actually even preventable, but came in at a stage when we couldn't really do much more than try to help keep their symptoms under control. So I think some of the concerns that I have are that people need to be aware that not having finances, not having maybe transportation, not having adequate access to healthcare is not a reason not to present to the physician's office. A lot of the doctor's offices, including Rex Hospital, have a lot of support services that we can help patients with to help bridge some of the gaps that tend to occur.
As a physician, sometimes I feel a little bit helpless once the person leaves the clinic and I've done all that I can medically. But Circles of Care has actually helped me to feel more empowered in being able to then support someone outside of the clinic walls in their everyday practical needs. And that really helps to give me the fulfillment that I think I look for in interacting with people each day.
You know, as a surgical oncologist, I provide a surgical treatment plan, but I don't do that in a vacuum. I provide that in a team concept with a medical oncologist and a radiation oncologist and other nurse navigators and folks who are involved in treatment. So the treatment plans for the actual surgery, chemotherapy, and radiation are team-based, but I also think the support for the patient should be team-based as well.
Most of us are familiar with the African proverb, "It takes a village to raise a child." It raises the importance of relationships and gives a sense of community. Circles of Care can create this sense of community for African Americans dealing with cancer. If your organization is interested, please contact Stacy Peacock at 919-402-1844.